Vitamins that every diabetics must have. Did you know that adding certain vitamins to your routine could make balancing your blood sugar easier than ever? In today's video, we're diving into the top 4 vitamins for diabetics. Nutrients that have been shown to support blood sugar stability, boost insulin sensitivity, and promote overall health. Imagine having extra tools in your toolkit to make managing diabetes simpler. While these vitamins aren't a substitute for medication, they can give you a natural advantage in your journey toward better health. We'll break down the science behind these key vitamins and show you exactly how they work in your body. Plus, if you stick with us until the end, we'll share some easy, practical tips on how to get more of these vitamins naturally from foods you love. Whether you're new to diabetes management or looking to optimize your health, this video has something for you. So let's jump in and discover how these vitamins could be the missing link in your routine. And if you found any vitamins helpful in your journey, let us know in the comments below. 1. Thiamine B1. When managing diabetes, one vitamin that often goes unnoticed is thiamine, also known as vitamin B1. This essential nutrient plays a crucial role in several bodily functions, especially in maintaining nerve health. People with diabetes may experience thiamine deficiency due to various factors, including dietary habits and metabolic changes. A lack of this vitamin can contribute to neuropathy, a painful condition characterized by nerve damage that affects many individuals with diabetes. Research indicates that thiamine is important for carbohydrate metabolism. It helps convert carbohydrates into glucose, which the body uses for energy. This process is vital for maintaining stable blood sugar levels. Some studies suggest that higher doses of thiamine might improve lipid profiles, helping to lower cholesterol levels and reduce cardiovascular risks. Critical factors for those living with diabetes, who are often at a higher risk of heart disease. Furthermore, thiamine's antioxidant properties can help protect against oxidative stress, a condition that may lead to complications in diabetic patients. Ensuring adequate thiamine intake can therefore be an essential strategy for minimizing these risks. While research has not conclusively shown that thiamine directly impacts blood sugar control, its role in nerve function and overall metabolic health cannot be overlooked. To naturally increase your thiamine levels, consider adding foods rich in this vitamin to your diet, such as asparagus, beef liver, black beans, and whole grains. These options not only provide thiamine, but are also part of a balanced diet that supports overall health. However, it's crucial to consult with your healthcare provider before starting any supplements. While thiamine can support your health, it should never replace prescribed diabetes medications. In summary, understanding the significance of thiamine can empower individuals with diabetes to make informed dietary choices that enhance their health. By prioritizing thiamine-rich foods and discussing potential deficiencies with healthcare professionals, you can take proactive steps towards better diabetes management and improved quality of life. 2. Vitamin B12. Did you know that vitamin B12 plays a crucial role in supporting individuals living with type 2 diabetes? This powerhouse nutrient is not just important for your overall health, it's essential for maintaining nerve health and promoting the formation of red blood cells. For those grappling with complications like neuropathy, ensuring adequate vitamin B12 levels can be particularly beneficial. One challenge for many is obtaining enough vitamin B12, especially for those following a plant-based diet, as this vital vitamin is predominantly found in animal products such as beef liver, clams, dairy, eggs, and fortified cereals. If you're in this category, don't worry, there are solutions. Research indicates that vitamin B12 supplementation can offer significant benefits, particularly for individuals with long-standing diabetes or symptoms of neuropathy. In fact, studies suggest that starting supplementation early might improve health outcomes without causing adverse side effects. However, it's essential to approach supplementation with care. While vitamin B12 is generally safe, excessive intake can lead to unwanted symptoms, making it crucial to consult with a healthcare professional before adding any new supplement to your routine. To naturally boost your vitamin B12 intake, consider whipping up a delicious breakfast of scrambled eggs paired with a side of clams. Alternatively, a hearty beef stir-fry can not only satisfy your taste buds, but also enrich your diet with this important nutrient. By incorporating these foods into your meals, you're not just nourishing your body, you're also taking proactive steps to manage your diabetes effectively. Remember, vitamin B12 is not merely a vitamin, it's a powerful ally in your journey towards better health and diabetes management. Prioritize it in your diet and discover the positive impact it can have on your life. If you're finding this video helpful, make sure to hit that subscribe button and join our community. We want to hear from you, so leave a comment below sharing your thoughts or experiences with these vitamins. Stay tuned. There's so much more to discover, and you won't want to miss what's coming next. 3. Vitamin D. Let's explore our next essential vitamin, vitamin D. This nutrient is currently under extensive study for its potential impact on type 2 diabetes and various other health conditions. An intriguing question remains: does a deficiency in vitamin D lead to the onset of these diseases, or do the diseases themselves contribute to the deficiency? While experts continue to debate this, one thing is clear: correcting a deficiency is vital for overall health. Research has shown that vitamin D plays a crucial role in reducing insulin resistance, a condition where your body struggles to effectively use insulin. This is particularly significant for individuals with diabetes, as insulin resistance can complicate blood sugar management. Although vitamin D supplements haven't consistently demonstrated significant effects on fasting blood glucose or hemoglobin A1C levels, they can still contribute positively to your health journey. Imagine this. Anna, who has been navigating the challenges of diabetes, found out she had low vitamin D levels after a routine blood test. With her doctor's guidance, she started taking vitamin D supplements and incorporated fortified foods, such as dairy and cereals, into her diet. The results? She felt more energized and empowered in managing her condition. While vitamin D might not be a magic bullet for diabetes, ensuring adequate levels can certainly play a supportive role in your health strategy. This vitamin acts like a hormone in the body, influencing numerous processes, including immune function and inflammation reduction, which are vital for individuals managing diabetes. For those looking to boost their vitamin D intake naturally, sunlight is your best friend. Just 15 to 20 minutes of sun exposure several times a week can help your body produce this essential vitamin. Additionally, consider foods like fatty fish, such as salmon and mackerel, egg yolks, and fortified plant-based milks to enhance your vitamin D levels. Before starting any new supplements, always consult your healthcare provider. Balancing vitamin D levels is a step toward better health, helping you to navigate your diabetes management more effectively. So, stay informed and proactive about your health. It's not just about managing diabetes, it's about thriving. 4. Magnesium. Let's shine a light on the often overlooked powerhouse, magnesium. This essential mineral plays a crucial role in the lives of individuals with type 2 diabetes, where studies reveal a common pattern. Many people living with this condition often experience low magnesium levels. This deficiency is not just a minor issue, it can contribute to insulin resistance and may even heighten the risk of developing diabetes in the first place. The exciting news? Increasing your magnesium intake could significantly enhance both fasting and post-meal glucose levels, while also improving insulin sensitivity. Imagine a colleague of mine who battled with unpredictable blood sugar levels. After exploring dietary changes, he discovered that incorporating magnesium-rich foods like leafy greens, nuts, and whole grains had a transformative effect on his glucose stability. By enjoying a vibrant spinach salad sprinkled with pumpkin seeds or a handful of almonds as a snack, he not only felt better, but also saw a remarkable improvement in his blood sugar control. Research suggests that magnesium supplementation may also lead to lower blood pressure and a decreased risk of stroke, both of which are crucial for those managing diabetes. While the studies are promising, we must acknowledge that they are not yet conclusive. Large-scale clinical trials are still necessary to fully understand the breadth of magnesium's benefits and to develop solid recommendations. In the meantime, why not make magnesium a delightful part of your diet? Think about adding delicious black beans to your chili, roasting salmon with a sprinkle of sea salt, or enjoying a banana with your morning oatmeal. These simple changes can enhance your meals and contribute to your overall health in delicious ways. Remember, while boosting your magnesium intake can support your health, it's essential to consult with your healthcare provider before starting any new supplement regimen. Magnesium is more than just a mineral. It's a key ally in your journey toward better health and effective diabetes management. So let's celebrate the power of magnesium and embrace the positive changes it can bring to our lives. Top 5 vitamins. Every diabetics must take. Hui Sudong. They say managing diabetes is all about diet and exercise. But what if I told you there's a missing piece to the puzzle? These 5 vitamins could completely change the game for your blood sugar control. Living with diabetes isn't easy. Constant blood sugar checks, meal planning, and the fear of complications can feel overwhelming. But here's the good news. The right vitamins can help support your body in ways you never imagined. In this video, we're breaking down the top 5 vitamins every diabetic must take, backed by science and real results. Stick around because what you'll learn today might just be the breakthrough you've been looking for. Number 1. Magnesium. Let's talk about the first game changer, magnesium. You might think of it as just another mineral, but for diabetics, it's nothing short of essential. Here's why. Magnesium plays a crucial role in over 300 processes in your body, many of which directly impact how your body handles blood sugar. It helps regulate glucose metabolism and supports insulin function, 2 areas where people with diabetes often struggle. But here's the kicker. Studies show that people with diabetes are much more likely to have a magnesium deficiency. And when your magnesium levels are low, it's like throwing fuel on the fire. Low magnesium can make your insulin resistance worse, spike inflammation, and even mess with your blood pressure. So, what happens when you get enough magnesium? The results can be life-changing. Research published in Diabetes Care found that magnesium supplementation significantly improves insulin sensitivity, which means your body uses insulin more effectively to lower blood sugar. Another study from the American Journal of Clinical Nutrition showed that magnesium can also help reduce inflammation, an underlying issue that contributes to diabetes complications like heart disease and nerve damage. And that's not all. Magnesium has been shown to help lower blood pressure, a common problem for diabetics. High blood pressure puts extra strain on your heart and kidneys, which are already vulnerable when you have diabetes. So, by maintaining healthy magnesium levels, you're not just improving your blood sugar, you're protecting your whole body. Now, let's talk about how to get it. While magnesium is found in foods like spinach, almonds, and black beans, it's often hard to get enough from diet alone, especially if you have diabetes. That's where supplements come in. For the best results, look for magnesium citrate or glycinate. These forms are easier for your body to absorb. A daily dose of 200 to 400 milligrams is ideal, but always check with your doctor to make sure it's right for you. Adding magnesium to your routine might seem like a small step, but trust me, it can make a huge difference. It's like giving your body the tools it needs to fight back against diabetes and protect your health. Ready to hear about the next must-have vitamin? Stick around because the next one is a true powerhouse for managing blood sugar and preventing complications. Number 2. Vitamin D. Next on our list is vitamin D, often called the sunshine vitamin. But don't let the nickname fool you. This vitamin is a powerhouse when it comes to managing diabetes. If you're living with diabetes, there's a high chance you might be deficient in vitamin D. And here's why that's a problem. Vitamin D plays a critical role in how your body processes sugar and produces insulin. Studies have found that low vitamin D levels are closely linked to insulin resistance. What does that mean? Your body struggles to use insulin properly, which can lead to higher blood sugar levels. On top of that, vitamin D deficiency can impair the function of beta cells in your pancreas, the very cells responsible for producing insulin. And if that wasn't enough, low levels of vitamin D can increase inflammation, which worsens complications like nerve damage, heart disease, and kidney issues. So how can supplementing with vitamin D help? The benefits are nothing short of amazing. Research published in the Journal of Clinical Endocrinology and Metabolism found that supplementing with vitamin D can significantly improve insulin sensitivity, making it easier for your body to regulate blood sugar. Another study from Diabetes, Obesity, and Metabolism showed that vitamin D can enhance beta cell function, helping your pancreas produce insulin more effectively. But that's not all. Vitamin D is also a natural anti-inflammatory, which means it can help reduce the chronic inflammation that often accompanies diabetes. This can lower your risk of complications like neuropathy and cardiovascular disease. And let's not forget its role in supporting bone health, an important consideration for diabetics who are at higher risk for fractures. Now, here's how to make sure you're getting enough. The best source of vitamin D is sunlight. But let's be real, most of us don't get enough sun exposure, especially if we live in colder climates or spend most of our time indoors. That's where supplements come in. Experts recommend taking 1,000 to 4,000 international units IU of vitamin D3 daily. This form is the most effective at raising and maintaining your vitamin D levels. Worried about taking too much? Don't be. Vitamin D is safe when taken in recommended doses, but it's always a good idea to check your blood levels with your doctor. Maintaining optimal levels around 30 to 50 nanograms per milliliter can make a world of difference in your diabetes management. Adding vitamin D to your routine isn't just about managing your blood sugar, it's about giving your body the support it needs to thrive. Trust me, this small change can have a big impact on your overall health. Number 3. Chromium. Let's move on to another essential nutrient that often flies under the radar. Chromium. This trace mineral might not get as much attention as magnesium or vitamin D, but for diabetics, it's a game changer. Why? Because chromium is deeply involved in how your body processes sugar and uses insulin. Here's how it works. Chromium enhances insulin's ability to transport glucose from your bloodstream into your cells. Think of it as insulin's sidekick, helping it do its job more efficiently. When your body doesn't have enough chromium, this process can slow down, leading to higher blood sugar levels and worsening insulin resistance. But the good news? Supplementing with chromium can turn things around. A study published in Diabetes Technology and Therapeutics found that chromium supplementation significantly improved insulin sensitivity and reduced fasting blood sugar levels in people with type 2 diabetes. Another study in the Journal of Clinical Pharmacy and Therapeutics showed that chromium picolinate, a highly absorbable form of chromium, can also lower hemoglobin A1C levels, a key marker of long-term blood sugar control. For those struggling with insulin resistance, chromium offers a natural way to support your body's ability to manage glucose. And it doesn't stop there. Chromium has also been linked to reductions in cholesterol levels, which is important for diabetics at higher risk of heart disease. So, how much chromium should you take? Most experts recommend a daily dose of 200 to 1,000 micrograms of chromium picolinate. This form is preferred because it's more easily absorbed by the body. And while chromium is found in foods like broccoli, whole grains, and lean meats, it's tough to get enough through diet alone, especially if you're already deficient. Now, let's address a common concern. Is chromium safe? The answer is yes when taken within the recommended dosage. In fact, chromium is considered one of the safest supplements for diabetics, with very few reported side effects. However, it's always a good idea to consult with your doctor, especially if you're on medications like insulin or metformin, to ensure there are no interactions. Adding chromium to your daily routine could be the missing piece in your diabetes management plan. It's not just about lowering your blood sugar, it's about helping your body work smarter, not harder. Thank you for taking the time to watch today's video. I hope the information about vitamins beneficial for people with diabetes helps you improve your health effectively. Don't forget to hit like and subscribe so you won't miss more helpful health tips. Wishing you good health and see you in the next video. Number 4. Omega-3 fatty acids. Let's dive into a powerhouse nutrient that every diabetic should have in their corner. Omega-3 fatty acids. These healthy fats are not just good for your heart. They're essential for managing diabetes and protecting your overall health. Why are omega-3s so important? For starters, they help combat inflammation, which is a major player in both diabetes and its complications. Chronic inflammation can worsen insulin resistance, damage blood vessels, and increase the risk of heart disease. Omega-3s, particularly EPA eicosapentaenoic acid and DHA docosahexaenoic acid, act as natural anti-inflammatories, helping to reduce this harmful process. But the benefits don't stop there. Omega-3s are a lifeline for your heart. People with diabetes are 2 to 4 times more likely to develop heart disease, but omega-3s can help lower that risk. They reduce triglycerides, a type of fat in your blood that can clog arteries, and improve your overall lipid profile. According to a study published in Diabetes Care, omega-3 supplementation can significantly lower triglyceride levels, making it a key strategy for cardiovascular protection. Omega-3s also play a role in preventing blood clots and stabilizing heart rhythms, both of which are crucial for diabetics prone to cardiovascular events. Beyond heart health, some research suggests omega-3s may even improve insulin sensitivity, although this effect may vary from person to person. So, how can you make sure you're getting enough omega-3s? The easiest way is through supplementation. Look for high-quality fish oil or algae oil supplements that provide a combined daily dose of 1,000 to 3,000 milligrams of EPA and DHA. Algae oil is a great plant-based option for those who don't consume fish. If you prefer to get your omega-3s from food, focus on fatty fish like salmon, mackerel, and sardines. Aim for 2 servings of these fish per week, as recommended by the American Heart Association. For plant-based sources, flax seeds, chia seeds, and walnuts are good options. But keep in mind that their omega-3 content is in the form of ALA, alpha-linolenic acid, which your body must convert to EPA and DHA, an inefficient process. You might be wondering, are there any risks? Omega-3s are generally safe, but taking very high doses can thin your blood, so if you're on blood-thinning medications, talk to your doctor first. Incorporating omega-3s into your routine is one of the simplest yet most effective ways to support your heart, lower inflammation, and improve your overall health as a diabetic. It's like giving your body the tools it needs to fight back against the complications of diabetes. With omega-3s rounding out our list, you now have a comprehensive guide to the top 4 vitamins and supplements every diabetic should consider. Each one plays a unique role in helping you manage your condition and live a healthier, more balanced life. Number 5. Vitamin E. Finally, let's talk about vitamin E, a vital nutrient that often goes unnoticed but can make a significant difference in the lives of people with diabetes. Known as a powerful antioxidant, vitamin E works tirelessly to protect your cells from damage caused by free radicals, those harmful molecules that increase oxidative stress and fuel complications in diabetes. Why does oxidative stress matter so much? In diabetes, high blood sugar levels create a perfect storm for oxidative damage. This stress doesn't just harm your cells, it contributes to inflammation, damages blood vessels, and accelerates the development of complications like heart disease, nerve damage, and kidney problems. Here's where vitamin E steps in. It neutralizes free radicals, reduces oxidative stress, and helps shield your body from further harm. Research has shown that vitamin E can do more than just protect your cells. Studies suggest that it helps improve endothelial function, a key factor in maintaining healthy blood vessels. For diabetics, this is crucial because endothelial dysfunction is a precursor to cardiovascular disease. A study published in Diabetes Research and Clinical Practice highlighted that vitamin E supplementation significantly reduced markers of inflammation, such as C-reactive protein, CRP, in individuals with diabetes. Additionally, vitamin E may support better glycemic control. While it's not a direct treatment for high blood sugar, its ability to reduce inflammation and improve insulin sensitivity makes it a valuable ally in managing diabetes holistically. So, how can you include vitamin E in your daily routine? First, consider your diet. Foods rich in vitamin E include almonds, sunflower seeds, spinach, and avocados. However, most people don't get enough vitamin E from food alone, especially diabetics who may need higher amounts to combat oxidative stress. This is where supplementation becomes essential. Experts recommend a daily dose of 200 to 400 IU of natural vitamin E, D, alpha tocopherol for optimal benefits. always opt for natural forms of vitamin E, as they are better absorbed and utilized by the body compared to synthetic versions. But here's a word of caution. Too much of a good thing can be harmful. Excessive vitamin E intake, especially in supplement form, can increase the risk of bleeding, particularly if you're on blood-thinning medications. Always consult your healthcare provider before starting any new supplement regimen. Vitamin E isn't just about preventing complications, it's about giving your body the tools it needs to thrive. By reducing oxidative stress and inflammation, vitamin E helps you take control of your health, protect your heart, and improve your quality of life. Top 4 small vitamins that will eliminate frequent urination. Do you feel tied down by frequent trips to the bathroom? It's more than just an inconvenience. It's a challenge that affects millions of people every day. But what if I told you that there are simple vitamins that could help reduce those constant trips and give you back control? You're not alone. Over 25 million adults in the U.S. struggle with urinary incontinence, yet it's something many don't talk about. The good news? Certain vitamins might be the key to improving your bladder health. In today's video, we're revealing the top 4 small vitamins that can support your bladder and potentially ease your symptoms. Stick around to discover how adding these vitamins to your daily routine could make a world of difference for you or someone you care about. 1. Vitamin D. Let's delve into the significant role vitamin D plays in combating frequent urination. Often dubbed the sunshine vitamin, vitamin D is well known for its myriad health benefits, including its crucial role in developing strong bones, supporting immune function, and enhancing overall health. However, new research suggests an exciting connection between vitamin D levels and bladder health, particularly in preventing urinary incontinence. It turns out that vitamin D deficiency may be a hidden factor in bladder dysfunctions, making it a key player in managing urinary incontinence. By ensuring adequate vitamin D levels, you help regulate bladder muscles, improving control and stability. Optimal vitamin D levels can lead to fewer incidents of an overactive bladder and significantly less frequent urination. So, how can you boost your vitamin D levels? One of the first places to start is with your diet. Enrich it with vitamin D-rich foods. Fatty fish, such as salmon, trout, and tuna, are excellent natural sources. Not only do these fish provide vitamin D, but they are also chock full of omega-3 fatty acids, which support heart health. Additionally, dairy products like milk and yogurt are often fortified with vitamin D, offering a double benefit of calcium and probiotics for your digestive system. Fortified breakfast cereals and fruit juices also make it easy to integrate vitamin D into your morning routine, ensuring you start your day with a nutrient boost. Egg yolks provide another splendid source. These gems are not only full of vitamin D, but also other essential nutrients like choline, which supports brain health. Mushrooms, particularly those exposed to ultraviolet light, are another unique source of vitamin D. These mushrooms can significantly up your intake, adding variety and flavor to your meals. The natural and often most effective way to increase your vitamin D levels is through sun exposure. Spending just 10 to 30 minutes in the sunlight several times a week can dramatically enhance your vitamin D synthesis. However, geographic location, skin type, and lifestyle factors can impact your exposure to sunlight, which is why a vitamin D supplement may be beneficial, especially during the winter or in less sunny climates. Including these dietary sources of vitamin D not only supports your bladder health but promotes a balanced, nutrient-rich diet that can aid in healthy weight management and help reduce high blood pressure, offering a comprehensive approach to improving your health. The link between vitamin D and reduced urinary symptoms offers a straightforward premise. By addressing a vitamin D deficiency, you can take proactive steps to control frequent urination and improve your quality of life. As always, it's best to discuss changes in your diet or supplementation with a healthcare provider to ensure these adjustments align with your overall health plan. 2. Vitamin B12. Let's explore another key player in managing urinary incontinence, vitamin B12. This essential vitamin has a profound impact on our nervous system, which in turn plays a pivotal role in bladder control. A deficiency in vitamin B12 can lead to nerve damage, which is one of the contributing factors to urinary incontinence. Ensuring adequate levels of vitamin B12 becomes crucial in supporting nerve function and maintaining healthy bladder control. Vitamin B12 is primarily found in animal-based products, making it readily accessible for those who include meat, fish, poultry, eggs, and dairy in their diets. These foods are rich sources, providing a substantial amount of this vital nutrient to meet daily requirements. For instance, just a serving of salmon or a glass of milk can contribute significantly to your daily B12 intake. Beyond direct consumption, the B12 found in these foods is highly bioavailable, meaning your body can absorb and utilize it effectively, maximizing its benefits for the nervous system and consequently bladder health. For those following a vegetarian or vegan diet, ensuring enough vitamin B12 can be a bit more challenging, however, not impossible. Some plant-based foods are fortified with vitamin B12, such as soy milk, breakfast cereals, and nutritional yeast. It's worth noting that the bioavailability of B12 in these sources might vary, so it's essential to check nutritional labels and adjust your intake accordingly. Nutritional yeast, in particular, is an excellent option for those seeking a B12 boost, as it can be easily sprinkled on various dishes to add a cheesy flavor while enhancing vitamin levels. Many breakfast cereals are also fortified with vitamin B12, which makes for a convenient and tasty start to the day. For individuals who have dietary restrictions or difficulty absorbing B12 from food, supplements offer a practical solution. Vitamin B12 supplements are widely available and can be an effective way to meet daily requirements and support nervous system health. It's always advisable to consult with a healthcare professional to determine the appropriate dosage and to ensure that supplementation aligns with personal health needs. Maintaining adequate vitamin B12 levels is not only essential for preventing nerve damage and supporting bladder control, but also contributes to overall energy levels and cognitive function. According to reputable sources like the National Institutes of Health, ensuring a sufficient B12 intake can help reduce feelings of fatigue and enhance mental clarity, allowing you to engage more fully with your daily activities. Making sure that vitamin B12 is part of your dietary regimen can be a significant step towards managing frequent urination effectively. By supporting your nervous system, you're actively contributing to better bladder control and improving your overall quality of life. Remember, small changes in your dietary habits can lead to substantial health benefits, empowering you to live a more confident and comfortable life. Before we continue the video, can I ask you a question? If you found these tips helpful, please hit subscribe so you can stay updated with more practical advice and insights for managing diabetes effectively every day. We really want to help you. 3. Vitamin C. Vitamin C, widely known for its immune-boosting powers, holds a special place in our daily nutrition. But beyond its popularity as a champion of general health, it also has a specific role in managing urinary incontinence. Acting as a potent antioxidant, vitamin C can help reduce inflammation within the bladder, which in turn can alleviate urinary urgency and support overall bladder health. This makes vitamin C an invaluable part of our strategy to combat frequent urination. Incorporating more vitamin C into your diet is a delicious endeavor, thanks to its abundance in fruits and vegetables. Citrus fruits like oranges, grapefruits, lemons, and limes are fantastic sources, providing a refreshingly tangy way to ensure your daily intake. They transform your salads, juices, and even plain water into delightful experiences while top up your vitamin C levels. Beyond citrus, berries such as strawberries, raspberries, and blueberries offer a delightful pop of color and are packed with vitamin C. These berries can easily be added to your breakfast bowl, snacks, or desserts, making them a versatile option that's as beneficial as it is tasty. Don't forget about other fruits like kiwis, pineapples, papayas, and mangoes, each bursting with vibrant flavors and nutrients. You can enjoy them on their own or blended into smoothies that are sure to jazz up your daily vitamin C quota. These fruits aren't just about the vitamins. They introduce essential dietary fibers and hydration into your diet, crucial for overall health maintenance. Vegetables are another excellent source of vitamin C. Bell peppers, for instance, not only add color to your meals but also deliver a hefty dose of vitamin C. Broccoli, Brussels sprouts, and tomatoes are other rich vegetable sources, easily incorporated into a variety of dishes from stir-fries and casseroles to fresh salads. A useful pro tip: vitamin C, also known by its scientific name ascorbic acid, is water-soluble. This means it dissolves easily in water, making it simple to incorporate into your diet through effervescent tablets or supplements if you're struggling to meet your nutritional needs through food alone. Many supplements are designed to dissolve in water, making them convenient for those on the go. According to the Mayo Clinic, while eating foods rich in vitamin C is beneficial, widespread concerns about overdosing via food sources are minimal due to its water-soluble nature. The body excretes excess amounts, but it's always wise to consult with a healthcare professional if you choose supplements to tailor your regimen to your specific needs. Incorporating vitamin C into your daily routine not only supports your immune system, but may also contribute to better bladder health, reducing inflammation and urgency. This simple change could bring comfort and confidence back into your day, allowing you to focus less on frequent urination and more on living your best life. By focusing on these dietary choices, you can take significant steps toward managing urinary incontinence effectively, enhancing both your well-being and quality of life. 4. Magnesium and vitamin E. Rounding out our list are two pivotal nutrients that work beautifully together to support bladder health: magnesium and vitamin E. While both have individual benefits for muscle and nerve function, they collectively play a significant role in maintaining a healthy urinary system, making them worthy of attention if you're looking to manage frequent urination. Magnesium is fundamentally essential for muscle function and nerve transmission. It helps regulate the muscles that control your bladder and promote smoother and more controlled contractions. According to studies, magnesium deficiency has been associated with muscle spasms and cramps, potentially worsening urinary incontinence. Ensuring adequate magnesium levels can ease an overactive bladder, contributing to fewer urges and accidents. Incorporating magnesium into your diet can be both simple and delicious. It's abundant in leafy green vegetables, nuts, seeds, and whole grains. Spinach, almonds, and pumpkin seeds in particular are excellent choices to fortify your magnesium intake. Whole grains and legumes are also supportive, adding both fiber and magnesium to your meals for double the digestive benefits. Besides, magnesium supplements are widely available for those who might struggle to get enough through diet alone, though it's always best to consult with a healthcare professional before starting any new supplements. Vitamin E, on the other hand, excels as an antioxidant. This means it helps combat oxidative stress and reduce inflammation, crucial for maintaining the health and function of your bladder tissue. Through its anti-inflammatory properties, vitamin E may help decrease bladder irritation, contributing to improved control over the urinary system. While dietary sources of vitamin E include nuts like almonds and seeds, it's also present in green leafy vegetables, making it relatively easy to incorporate into your diet. To build a diet rich in magnesium and vitamin E, consider including a variety of nuts and seeds in your snacks or salads, and focus on leafy greens as a meal staple. These choices will not only support your bladder health, but also offer comprehensive nutritional benefits, aiding in heart health and promoting healthy skin. Ultimately, when it comes to managing frequent urination or urinary incontinence, it's about creating a holistic lifestyle approach. Incorporating magnesium and vitamin E-rich foods and practicing mindful lifestyle adjustments can positively contribute to your health journey. Top 6 vitamins diabetics must know. Lower blood sugar. Are you puzzled by why your blood sugar just won't stabilize no matter what you do? What if it's because you're missing out on some key vitamins? Keep watching, and I'll show you the top 6 vitamins that can seriously help with your diabetes and bring those blood sugar levels down. Combining certain vitamins into your daily routine can be a game changer for managing diabetes. These essential nutrients don't just support your overall health, they help your body use insulin more effectively and keep your blood sugar at a steady, healthier level. By integrating these vitamins, you're not only boosting your energy, but also enhancing your body's natural ability to control blood sugar, reducing highs and lows that can disrupt your life. Let's dive into how these top 6 vitamins can make managing diabetes smoother and more efficient for you. 1. Vitamin B6. Let's talk about a vitamin that often flies under the radar but is super important for anyone dealing with diabetes: vitamin B6. Now, you might not have heard about this, but it plays a critical role in intercepting a process called glycation. This is when the glucose in your bloodstream clings to proteins. The downside? It forms harmful molecules known as advanced glycation end products, or AGEs for short. These AGEs can accelerate the damage to tissue and organs, which isn't something any of us want. But here's the good news. Vitamin B6 helps keep this glycation in check. And there's more. Vitamin B6 is your ally in preventing diabetic neuropathy, a type of nerve damage that can occur in people with diabetes. By supporting nerve health, vitamin B6 can be a real lifesaver, reducing pain and discomfort that many with diabetes face. Now, let's talk about where you can get this powerhouse of a vitamin. If you're into plant-based foods, bananas, spinach, and broccoli are excellent choices. Red capsicum, baked potatoes, chickpeas, and pistachios are also packed with B6. And for those who love something meaty, lean chicken, beef, and fish are your vitamin B6 go-tos. Incorporating these foods into your daily meals is not just about adding variety to your diet. It's about taking a proactive step in managing your blood sugar levels and protecting your body's nerves from future complications. According to research from trusted sources like the National Institutes of Health, a consistent intake of vitamin B6 not only supports overall metabolic function but also enhances your body's capability to regulate blood glucose levels. By making sure vitamin B6 is part of your diet, you're not just fighting diabetes, you're also empowering your body to function at its best. So why not give it a try? Start by adding some of these foods to your shopping list. It's a simple change that can make a big impact on your health journey. With each meal, you're doing more than just eating. You're nourishing your body and taking control of your health path. Remember, every small step counts when it comes to managing diabetes, and vitamin B6 is definitely a step in the right direction. Step 2. Vitamin B12. Now, let's dive into another critical vitamin for anyone managing diabetes. Vitamin B12. If you're taking metformin, commonly prescribed for type 2 diabetes, listen closely because this is key. Metformin, while effective for controlling blood sugar, can interfere with your body's ability to absorb vitamin B12 in the small intestine. This means supplementation isn't just beneficial, it's often necessary. A lack of vitamin B12 doesn't just leave you feeling tired or weak. It can lead to diabetic peripheral neuropathy, a serious complication involving nerve damage that affects many living with diabetes. It's a hidden challenge that can make daily life difficult, but it's one we can tackle head-on with proper nutrition. Vitamin B12 is mostly found in animal products, making it a bit tricky for vegetarians to get enough from their diet without supplements. But don't worry, there are ways around this. Vegetarians can turn to dairy products like milk, yogurt, and buttermilk, and even fortified soy milk to help meet their vitamin B12 needs. For those who include animal products, foods like liver, kidneys, beef, seafood, and eggs are rich in B12. It's important to note that alongside B12, vitamins B6 and B1 also play crucial roles in preventing nerve damage from diabetes. They work together to keep your nerves healthy and functioning well. According to credible sources like the Mayo Clinic, ensuring you get enough vitamin B12 is vital, not just for energy and well-being, but for maintaining nerve health and supporting healthy red blood cell production. So, if you're on metformin or concerned about nerve health, consider assessing your vitamin B12 intake. Talk to your healthcare provider about the best way to meet your needs, whether through diet, supplements, or a combination of both. This simple step can make a significant impact on your overall health and diabetes management. Remember, empowering yourself with the right nutrients means equipping your body to face diabetes with strength and resilience. 3. Biotin. Let's explore a lesser-known yet powerful vitamin for diabetes management. Biotin. Often overshadowed by its more famous vitamin counterparts, biotin plays a vital role in maintaining glucose and insulin balance, which is crucial for people with diabetes. It's like your metabolic sidekick, quietly working behind the scenes to support key processes in your body. Biotin acts as a catalyst for the enzyme glucokinase, found in your pancreas and liver. This enzyme is responsible for turning glucose into glucose 6-phosphate, an essential step in managing blood sugar levels. By enhancing this process, biotin helps improve how your body handles glucose and insulin, making it an invaluable addition to diabetes care. Looking to get more biotin naturally? You'll find it in a variety of delicious foods. Egg yolks, almonds, and cauliflower are fantastic, readily available sources. Don't forget about mushrooms, sweet potatoes, and salmon, which are also rich in biotin. Including these in your meals can help boost your biotin intake, supporting better glucose metabolism and overall health. According to research shared by reputable outlets like the American Diabetes Association, biotin not only supports glucose regulation, but also aids in reducing the risk of nerve damage, a common concern for diabetics. Now, that's a double win. If you're someone looking to enhance your diabetes management, consider incorporating these biotin-rich foods into your diet. While supplements are an option, getting nutrients from whole foods ensures that you're not just filling a gap, but also gaining additional health benefits from the fiber, essential fats, and other nutrients these foods offer. So take that step towards a more nutritious diet and improved health by embracing the benefits of biotin. Remember, managing diabetes is not about restrictions, but about making empowering choices that support your body. Together, with informed decisions and nutrient-rich foods, you can achieve better blood sugar control and a healthier lifestyle. 4. Vitamin D. Next up on our list is vitamin D, often dubbed the sunshine vitamin, and for good reason. Vitamin D is absolutely essential for the synthesis of insulin, which plays a direct role in regulating blood sugar levels. Without enough vitamin D, your body might struggle to produce insulin efficiently, making it harder to keep blood sugar in check. While the best way to soak up vitamin D is through getting some sunlight, which naturally stimulates its production in the skin, there are also fantastic food sources you can turn to. Think about adding sunflower seeds, egg yolks, and fatty fish like salmon to your diet. Don't forget mushrooms, cheese, and soy products too. All these foods offer a healthy dose of vitamin D. A lack of vitamin D has been linked to insulin resistance, a precursor to diabetes, so ensuring you're getting enough can play a critical role in both prevention and management. Reliable studies from reputable health organizations, including the Harvard School of Public Health, highlight vitamin D's importance not just in bone health, but in managing and potentially reducing the risk of type 2 diabetes. For those living in areas with less sunlight or dealing with long winters, focusing on these vitamin D-rich foods and considering a supplement could be particularly important. It's about more than just maintaining good levels of this vitamin. It's about supporting your body's overall capability to manage sugar effectively. As you think about your diet, integrating these sources of vitamin D could be a key step in better diabetes management. It's small changes like enjoying a salmon salad or incorporating some mushrooms into your meals that can make a real difference. Combining these efforts with regular sunlight exposure whenever possible can significantly support your body's natural processes. Remember, improving your health doesn't always require big changes. Sometimes it's the small, consistent efforts that create the most impact. Stay informed, take control, and give your body the best chance to manage diabetes effectively with the support of vitamin D. 5. Vitamin C. Let's turn our attention to a vitamin that offers incredible benefits for both type 1 and type 2 diabetics. Vitamin C. Known for its immune-boosting properties, vitamin C is also vital in diabetes management. For those with type 1 diabetes, combining insulin with vitamin C can help prevent blood vessel damage. It's like giving your circulatory system a shield against the potential harm diabetes might cause, making it one of the best vitamins for managing type 1 diabetes. On the other hand, if you're dealing with type 2 diabetes, vitamin C plays a different yet equally important role. It enhances glucose tolerance, meaning your body can handle sugar more effectively. It also prevents oxidative damage, a process that can wreak havoc on your cells and arteries, potentially leading to complications. With vitamin C, you're not just managing diabetes. You're actively working to improve your arterial health and overall well-being. Incorporating vitamin C into your diet is both simple and delicious. Embrace the vibrant flavors of citrus fruits like oranges and grapefruits. Add some excitement to your meals with leafy greens like spinach or a splash of color with yellow capsicum. Don't overlook the benefits of broccoli, green chilies, strawberries, papaya, and guava, all packing a punch of vitamin C. As highlighted by research from the American Diabetes Association, maintaining sufficient levels of vitamin C can support vascular health, lessen inflammation, and even improve quality of life for diabetics by reducing the risk of secondary complications. If you're wondering how to get more vitamin C, start with your grocery shopping list. Throw in a variety of these fruits and veggies, and you'll be on your way to a healthier lifestyle. Remember, this isn't about limitations. It's about adding more vibrant, nutrient-rich foods to support your journey. So next time you're at the store, pick up some vitamin C-rich foods and take a proactive step in managing your diabetes. It's about empowering yourself with knowledge and choices that genuinely make a difference in your health and well-being. Because with the right nutrients, you can tackle diabetes head-on, supporting both body and mind. 6. Vitamin E. Let's wrap up our exploration with an incredibly important vitamin, vitamin E. This powerhouse vitamin does more than just provide a glowing complexion. It plays a vital role in supporting diabetes management. One of its key functions is oxygenating the blood, which can enhance the activity of insulin within the body. For someone with diabetes, this means potentially better blood sugar management and fewer complications. Vitamin E is renowned for its antioxidant properties, which are crucial in preventing complications that arise from oxidative stress, a common concern for diabetics. This stress can damage cells and lead to various health issues, but vitamin E helps keep these damaging processes in check. You can find high levels of vitamin E in a variety of delicious foods. Almonds, peanuts, and hazelnuts are great snacks that offer a good dose of this vitamin. Avocados are not only creamy and delightful, but also packed with vitamin E. Don't forget about sunflower seeds, spinach, and broccoli, which can easily be integrated into salads and main dishes to boost your intake. Research from the Linus Pauling Institute highlights the benefits of vitamin E in enhancing immune function and reducing oxidative stress, supporting overall cardiovascular health, key areas of concern for people with diabetes. Including these foods in your daily diet can not only boost your health but also arm you against the oxidative battles your body faces. By opting for simple dietary changes, you take proactive steps towards improving your blood sugar control and enhancing your overall well-being. So next time you reach for a snack or plan your meals, remember how easy yet impactful it is to add vitamin E-rich foods. It's all about empowering yourself with the right choices that support your diabetes management journey. Because with the right nutrients, you can foster a stronger, healthier you, ready to take on diabetes with renewed energy and resilience. Top 3. Essential vitamins to stop frequent. Nighttime urination, lower blood sugar. Waking up multiple times at night to pee? It's not just annoying, it could be a warning sign. Many blame aging or late-night drinks, but frequent urination can signal diabetes, bladder issues, or an overactive bladder. If blood sugar runs high, your kidneys work overtime, leading to constant trips to the bathroom, draining your energy and wrecking your sleep. One person shared, "Before my diagnosis, I woke up every 2 hours. Once I controlled my blood sugar, the wake-up stopped, and I felt brand new." The good news? 3 key vitamins can help reduce nighttime urination naturally. Add them to your routine and finally get the deep sleep you need. 1. Vitamin D. Think waking up multiple times at night to pee is just a normal part of aging? Think again. If you find yourself making frequent trips to the bathroom in the middle of the night, it might not be because you drank too much water before bed. In fact, the real culprit could be something far less obvious, a deficiency in vitamin D. Most people think of vitamin D as the sunshine vitamin that helps build strong bones and support immune function. But what they don't realize is that it plays a crucial role in bladder health. Research shows that people with low vitamin D levels are significantly more likely to suffer from bladder dysfunction, including nocturia, frequent nighttime urination. But why does this happen? Your bladder isn't just a simple storage organ, it has receptors for vitamin D, meaning this vitamin directly influences how your bladder functions. When your body doesn't have enough vitamin D, these receptors don't work efficiently. As a result, you may experience increased urgency and frequency, especially at night. But that's not all. Vitamin D also plays a key role in maintaining muscle strength, including the muscles responsible for bladder control. These muscles, known as the pelvic floor muscles, help regulate urine flow. When they weaken, it becomes harder to hold urine for extended periods, leading to more frequent bathroom trips. The symptoms of vitamin D deficiency go far beyond just frequent urination. Here are some signs that your body may be lacking this essential nutrient. Muscle weakness and fatigue. Your muscles, including those controlling your bladder, may not function optimally. Bone pain and weakness. Since vitamin D is crucial for bone health, a deficiency can lead to joint pain and an increased risk of fractures. Depression and mood swings. Low levels of vitamin D have been linked to mood disorders, including anxiety and depression. Compromised immune function. You may find yourself getting sick more often as vitamin D is essential for a strong immune system. Vitamin D deficiency is far more widespread than most people think. Studies estimate that nearly 40% of adults in the U.S. have inadequate vitamin D levels, and this percentage is even higher in older adults, those with darker skin, and people who spend most of their time indoors. Certain lifestyle factors also contribute to vitamin D deficiency, such as living in regions with limited sunlight, wearing excessive sunscreen, working indoors for long hours, following a diet low in vitamin D-rich foods. How to increase your vitamin D levels. The good news is that increasing your vitamin D levels is relatively easy if you take the right steps. Here are the best ways to ensure your body gets enough of this essential nutrient. The most natural way to boost vitamin D levels is through sun exposure. Your skin produces vitamin D when exposed to UVB rays from the sun. Experts recommend spending 15 to 20 minutes in the sun daily, preferably during midday when UVB rays are strongest. However, factors like skin tone, age, and geographic location can affect how efficiently your body synthesizes vitamin D. If getting enough sunlight isn't an option, incorporating vitamin D-rich foods into your diet can help. Some of the best sources include fatty fish, salmon, mackerel, sardines, tuna, egg yolks, fortified dairy products, milk, yogurt, cheese, fortified cereals, and orange juice. For those who struggle to get enough vitamin D from sunlight and food alone, supplements can be a reliable solution. The recommended daily intake varies based on age and individual needs, but most adults benefit from 600 to 800 IU per day. In cases of severe deficiency, doctors may prescribe higher doses. If you're constantly waking up at night to use the bathroom, correcting a vitamin D deficiency could be the key to improving your sleep. Since vitamin D supports bladder control, muscle function, and overall relaxation, ensuring you have optimal levels can help you sleep through the night without annoying interruptions. Additionally, vitamin D is involved in the regulation of melatonin, the hormone responsible for sleep. Studies suggest that maintaining healthy vitamin D levels may improve sleep quality, reduce insomnia, and help you wake up feeling more refreshed. If you're struggling with frequent nighttime urination and disrupted sleep, it may be time to check your vitamin D and magnesium levels. Ensuring your body gets enough of these essential nutrients can improve bladder function, strengthen muscles, and help you sleep peacefully through the night. So, what are you waiting for? Step outside, soak up some sunlight, add vitamin D and magnesium-rich foods to your diet, or consider high-quality supplements. Your bladder and your sleep will thank you. 2. Magnesium. Tired of waking up in the middle of the night to pee? Your bladder might be missing one crucial mineral, magnesium. We all know the frustration of tossing and turning, finally drifting into a deep sleep only to be jolted awake by that all-too-familiar urge to use the bathroom. It's not just annoying, it's exhausting. But what if there was a simple, natural way to regain control over your bladder and finally enjoy a full night's sleep? Magnesium plays a powerful role in bladder control, yet most people don't realize how essential it is. This mineral helps relax muscles and regulate nerve function, both of which directly impact how often you need to go. When magnesium levels drop too low, your bladder muscles can become overactive, leading to frequent urges, especially at night. Ever feel like your bladder has a mind of its own, waking you up at the worst times? A magnesium deficiency could be the hidden reason. Magnesium helps calm the nerves that tell your bladder when to empty, preventing those sudden, urgent trips to the bathroom. Research from the National Institutes of Health, NIH, shows that magnesium supplementation can significantly improve overactive bladder symptoms, one of the biggest culprits behind nocturia, waking up at night to urinate. By keeping your bladder muscles in check, magnesium helps reduce spasms, allowing you to hold urine longer and sleep more soundly. That means fewer interruptions, deeper rest, and waking up feeling refreshed instead of exhausted. Many people don't realize they're magnesium deficient. In fact, studies suggest that up to 50% of Americans aren't getting enough of this crucial mineral. Here are some signs your body might be craving more magnesium: frequent nighttime urination, muscle cramps or spasms, anxiety or restlessness, difficulty falling or staying asleep, fatigue or low energy levels, constipation. If you're experiencing any of these symptoms, especially the constant urge to pee at night, your body might be trying to tell you something. Several studies have explored the connection between magnesium and bladder health. A study published in the British Journal of Urology found that women who took magnesium supplements experienced a significant decrease in symptoms of overactive bladder, including fewer nighttime bathroom trips. Another study from the National Institutes of Health concluded that magnesium supplementation helped relax the bladder muscles and improve urinary retention, meaning fewer sudden urges and a better night's sleep. So, how do you get more magnesium? The best sources are whole, nutrient-dense foods that are easy to incorporate into your daily meals. Some of the richest natural sources of magnesium include leafy greens, spinach, kale, Swiss chard, nuts and seeds, almonds, cashews, pumpkin seeds, sunflower seeds, whole grains, quinoa, brown rice, oats, legumes, black beans, chickpeas, lentils, fatty fish, salmon, mackerel, dark chocolate. Yes, really? Look for varieties with at least 70% cocoa. If your diet falls short, magnesium supplements can be a great option. Magnesium citrate and magnesium glycinate are two of the most absorbable forms, making them ideal for people struggling with deficiency. If you're supplementing with magnesium, timing can make a big difference. Since magnesium promotes muscle relaxation and better sleep, taking it in the evening can help reduce nighttime bathroom trips while also improving overall sleep quality. Here's a simple nighttime routine to support bladder health. About 30 to 60 minutes before bed, take a magnesium supplement with a glass of water. Avoid caffeine and alcohol in the evening, as both can irritate the bladder. Try deep breathing or meditation to relax your nervous system. Stress can make bladder issues worse. Beyond bladder control, magnesium plays a vital role in over 300 biochemical reactions in the body. Getting enough magnesium doesn't just help with nocturia, it can also reduce muscle cramps and spasms, lower stress and anxiety, improve digestion and prevent constipation, support heart health by regulating blood pressure, boost energy levels and reduce fatigue, enhance bone health and prevent osteoporosis. Despite its importance, there are several misconceptions about magnesium. You get enough magnesium from your diet alone. While it's possible, many people still fall short due to soil depletion and processed foods. Different forms have different absorption rates. Magnesium oxide, for example, is poorly absorbed, while magnesium glycinate is highly effective. Too much magnesium is dangerous. While excessive doses can cause diarrhea, magnesium from food sources is safe, and most people don't get enough to begin with. By making sure you get enough magnesium, whether through food or supplements, you're giving your bladder the support it needs to function properly. And finally, you can sleep through the night without those annoying interruptions. If you found this information helpful, don't forget to subscribe for more health tips and wellness insights. 3. Vitamin C. Most people know vitamin C as an immune booster, but here's what they don't realize: it could be the key to fewer nighttime bathroom trips. If you find yourself waking up multiple times during the night just to urinate, your body might be trying to tell you something more than just drink less water before bed. Frequent nighttime urination, also known as nocturia, affects millions of people worldwide, often disrupting sleep and decreasing quality of life. But while most solutions focus on fluid intake or bladder training, there's one factor that many overlook: vitamin C deficiency. One of the biggest hidden causes of frequent urination at night isn't just hydration or bladder habits, it's inflammation. When the bladder or urinary tract is irritated, it sends constant signals to the brain, making you feel like you need to go even when it's not full. This is where vitamin C steps in. Its powerful anti-inflammatory properties help calm the bladder, reducing unnecessary trips to the bathroom and allowing you to get the deep, uninterrupted sleep your body needs. Inflammation in the urinary tract can stem from various sources, including dietary irritants, infections, oxidative stress, and even aging. By combating inflammation at the root, vitamin C helps restore normal bladder function and prevents the constant urge to urinate. But that's not all. Most people associate collagen with skin health. But did you know that your bladder is also made of collagen? Collagen provides structure, strength, and elasticity to the bladder wall, helping it expand and contract as needed. As we age, collagen production naturally declines, weakening the bladder walls and making it harder to retain urine for long periods. That's why so many people struggle with nocturia as they get older. It's not just a hydration issue. It's a structural problem within the bladder itself. When the bladder loses its elasticity, it becomes more sensitive to pressure and less efficient at holding urine, leading to frequent urges to urinate. By boosting collagen synthesis, vitamin C helps maintain bladder strength, allowing it to store urine more efficiently and reducing those middle-of-the-night urges. This is especially important for postmenopausal women and older adults, as collagen loss accelerates with age. Another major benefit? Vitamin C is a powerhouse antioxidant. Like any other organ, the bladder is vulnerable to oxidative stress from toxins, aging, and environmental factors. Over time, this damage weakens bladder cells, leading to dysfunction. Research from the National Institutes of Health, NIH, shows that antioxidants like vitamin C help protect bladder health, reducing oxidative stress and slowing down premature aging. Oxidative stress plays a crucial role in bladder dysfunction, contributing to conditions like interstitial cystitis, overactive bladder, and urinary tract infections, UTIs. Studies indicate that people with chronic bladder issues often have lower levels of antioxidants, making them more prone to irritation and inflammation. By neutralizing harmful free radicals, vitamin C acts as a protective shield, reducing bladder irritation and promoting long-term health. The best part? Getting enough vitamin C is easy. Citrus fruits like oranges, lemons, and grapefruits are packed with it, as are strawberries, blueberries, bell peppers, and broccoli. But if you're not getting enough from food, supplements can help fill the gap. In fact, the Cleveland Clinic suggests that vitamin C supplements may reduce nocturia symptoms in those who are deficient. If you want to improve your bladder health naturally, adding vitamin C-rich foods to your diet is a great start. Here are some of the best options: citrus fruits, oranges, grapefruits, lemons, limes, berries, strawberries, blueberries, raspberries, blackberries, vegetables, bell peppers, broccoli, Brussels sprouts, kale, tropical fruits, kiwi, pineapple, mango, papaya, other sources, tomatoes, guava, acerola cherries. If your diet is lacking in vitamin C, supplements can be a convenient way to ensure you get enough. When choosing a supplement, look for ascorbic acid or a natural form like rose hips or acerola cherry extract for maximum absorption. The recommended daily intake for adults is around 75 to 90 milligrams, but higher doses, up to 500 to 1,000 milligrams, are often used for their anti-inflammatory and immune-boosting benefits. However, balance is key. Excessive vitamin C intake, above 2,000 milligrams per day, can lead to side effects like stomach discomfort or kidney stones in sensitive individuals. If you're prone to kidney issues, consult with a healthcare provider before taking high doses. While vitamin C can support everyone's bladder health, certain groups stand to benefit the most. Older adults, collagen loss and increased oxidative stress make them more prone to bladder weakness and nocturia. Postmenopausal women. Lower estrogen levels affect collagen production, making bladder tissues less elastic. People with overactive bladder, OAB, vitamin C's anti-inflammatory properties help calm bladder irritation. Individuals prone to UTIs. Its immune-boosting and antioxidant effects support urinary tract health. People with interstitial cystitis, IC. Although IC patients need to monitor their vitamin C intake, controlled doses may help reduce inflammation. So, if you're tired of waking up multiple times a night, it might not just be your bladder habits, it could be a lack of vitamin C. By ensuring you get enough of this essential nutrient, you're not only boosting your immune system, but also strengthening your bladder, reducing inflammation, and improving your overall quality of life. Making a small adjustment to your diet or adding a vitamin C supplement could be the missing piece in your fight against nocturia. The results? Fewer bathroom trips, better sleep, a healthier bladder. Sounds like a game changer, doesn't it? Making just a few simple changes, boosting your vitamin D, magnesium, and vitamin C levels, along with a couple of lifestyle tweaks, can completely transform your bladder health. No more dragging yourself out of bed multiple times a night. No more sleep disruptions stealing your energy. Imagine waking up refreshed, feeling energized, and finally regaining control over your body. The best part? It's easier than you think. A little extra sunshine, nutrient-rich meals, and smarter hydration habits before bed can make all the difference. Small steps add up, and every choice you make brings you closer to better bladder control and overall well-being. If this video helped you, hit that subscribe button now and join Forever Health for more game-changing tips on managing diabetes and living your healthiest life.